And I thought what you said in the lecture yesterday was very enlightening, and maybe you'd just like to briefly explain what the main points of lower limb energy were.
Okay. Yeah. I'll talk to the camera, but
yes,
also
so,
to you. It was the study that you know, where they showed that the sensitivity of a pressure on the lower back is independent on how stiff the tissue is there. So that was surprising for me in chronic low back pain patients. And but the sensitivity is related to your protection mode of the brain.
That's right.
And they changed that very impressively by making a squeaking, alarming sound at the same time while pushing the tissue. And then everybody overestimated how forceful the pressure and how painful it is. When they made a soothing sound, the same pressure, 10 kilograms or 5 kilograms, was not overestimated. So I don't know, they didn't measure sympathetic nervous system activation or vagal tone, whether that already is a change in autonomic, but it means the central nervous system state is very important in chronic low back pain for the pain intensity that you have more than the stiffness of the tissue. And his suggestion, and that's for me a very intriguing question, is that when I do a roughing stroke, when you do IFT with one of your tools or with your hands, and you feel the tissue getting softer, and you tell it to the client, and then the client gets up and has less pain, whether the lessening of the pain may be related to the sound of your voice when you tell them. Now the tissue is getting softer.
Exactly.
Yeah.
And the form of communication.
Yeah. Yeah. And also the patient getting out of a fear, protection-oriented state, and that may, so the sound could get you in a sympathetic arousal, but it may be just your somatosensory nervous system making a prediction. So if I throw a medicine ball at you, you have a predictive coding on how big the impact will be.
Right. Yeah.
And that is not necessarily related to the autonomic nervous system, but basically by your constant act of predicting. Is this dangerous? Is it not dangerous? And what we do with the client is we give them self-treatment tools. We treat them in such a way that they can bend forward and say, oh, it's not dangerous. So I can do that when I stretch.
So we take them out of the danger zone.
Yeah.
And
that was for chronic low back pain.
Exactly.
So for acute neck pain, I know some studies where the pain sensitivity is related to the stiffness. So the more painful side of your neck is also stiffer, and vice versa.
Right.
So we need to find out where is it just a central nervous system prediction, generation of the pain, and where is the tissue condition the main driver of the pain.
Right. One of the main issues from interdisciplinary fascia therapy is the randomized control findings that we have looking at stiffness of lower lumbar back pain and how we hope to change that using slow, deep strokes, whether it be by the hand or whether we use the Fascia-ReleaZer, which we have here. This is the Fascia-ReleaZer, which you love to talk about, and which I love to talk about.
Yes.
And what we do is we use the Deep-ReleaZer here as a particular form of applicator where patients and therapists use this to get at the deeper structures of the lumbar spine. And so we use that as a deep stroking instrument, but we also use the Fascia-ReleaZer as a vagal tone stimulator.
Yeah.
Now, why do you think that is important dealing with chronic pain?
Well, we know that many myofascial pain conditions are augmented, they are increased by chronic stress. So there are many studies and also clinical observations in that. So how do you get somebody out of stress? Not only about the acute expectation of protection mode, but in general out of stress. And then the slow breathing that you can enhance with the second function that I like very much. Yeah. So I've never seen anybody besides you, and you have been doing that since several decades now, to combine myofascial tissue release, where you treat the tissue to get softer, to get better hydrated, and also treating the autonomic nervous system with state-of-the-art technology and knowledge behind it. And to combine that, as you have shown in one of the studies that I contributed, has a much more stronger effect than any of them alone.
Exactly. Yeah.
And I think that's one of your expertise.
Yeah.
And now you developed in the last 10 years, maybe, this beautiful vibratory tool. And I think it may be even more powerful than you are aware, coming from my psychologist background, because the client is in charge.
Exactly.
And
He takes control.
and when you drive the car yourself, even if you have been drinking alcohol, you feel safer than when your wife is driving. And it may be the opposite.
Right.
But whoever is in charge feels safe.
Yes.
So it's all about self-potency that you have there.
Right.
And that is a major predictor for low back pain. Not how much overweight you have, whether you have a head-forward posture, how much sugar you have, how much sex you have. They are very, whether you believe in God, they are very weak predictors, how many days you will leave work. But are you empowered in your life?
Well, this is what the IFT system is about. It's about self-empowerment.
Yeah.
It's about self-regeneration.
Yeah.
So IFT is about the self-therapy of the actual patient. That is the most important thing, because this gives sustainability.
Yeah.
The second thing is the actual self-therapy of the actual therapist, because the therapists get ignored.
Yeah.
They normally go to training courses after training courses. IFT caters for the self-therapy of the actual therapist. And the third is actually the methodology to reduce pain and stress on the patient from the point of view of the therapist. And that's what makes IFT so unique, because it's a threefold concept, a threefold methodology. But it's sustainability, which I feel we have to build up a different ethical code, because so many times we forget, well, it's not just helping the patient for a short amount of time, it's how long can we help them for? And this is why I actually developed all these different tools, because I'm looking for sustainability. And this is where you, with your argumentation of taking control, is so important.
And then the vibration is
well.
not a threatening vibration. I think one in a million will say, oh, this is threatening. Such a gentle vibration. What I love also about the heart rate variability function that you have there, where it every 5.5 seconds, correct me if I'm wrong, it makes a slight increase in the vibration.
Exactly.
And I can only pace my breathing to that if I get quiet.
Exactly.
And
it makes you focus.
Yeah, and get in a mindful attitude. And that by itself would be very beneficial.
Exactly.
Just for 10 minutes a day, get quiet and listen to your breathing, but then I get distracted. But here I notice immediately, oh, I forgot the pulse.
Exactly, because
I
it's
have to come
haptic.
back. So it's a haptic stimulation. You cannot just look at the computer as the normal heart rate variability trainings are doing. So that for me is a very potent tool that you have there. And I was just thinking that if I go up from this interview with empty hands, I wouldn't feel as powerful. Yeah. So if you leave a session, and I've done that for 36 years in my practice, where the client leaves me empty-handed, and that sticks in their brain.
Absolutely.
But if they leave with a tool in their hand, and a tool where they get very good instructions that they can only use by mindful attention, curious, friendly listening, that is a very powerful thing.
Well, that is something that I hope we're going to continue, because I think most therapists are looking to really ethically help their patients long term. And that is basically what we're striving for. This is what IFT is striving for. But we also have one last tool which might need a little bit of explaining, which is the needle roller.
That could be threatening.
It could be threatening if it's done in the wrong way, and if people have been taught how to use it.
So I'm making a
Something
speaking
like
sound like we had from
and then you get the fight-flight response. It arises the sympathetic. But then what we do here is explain that we want to not only work on the peripheral sensitization, we want to look at the central sensitization. And pain becomes central sensitized if it's been chronic over many years. So what we do is to teach the patients with a very gentle stroke. And then they're able to reframe their pain And they say, okay, well, that's okay, that's not threatening.
It's ideal because you use a stimulus that on first mental association would be dangerous. And you show them, oh, it's just like kerosene.
And because if we have needles, it's stimulating the brain to a very high degree.
Yeah.
And it's particularly stimulating the nociceptors, the free nerve endings, which are associated with a lot of peripheral pain.
Yeah.
And so we use the needle roller as a precursor before we do the fascia work.
Ah, okay.
And so we actually desensitize. We teach the patient not only that this can be done to stimulate all the mechanical receptors, but particularly the nociceptors. And then we get a microcirculation in the tissue. We get a desensitization possibly in the tissues. And then the whole fight-flight system gets quietened down.
Is it not making you also a little bit more, in a nice way, sympathetically awake? So I use it sometimes in the morning.
You can do both. You can do both.
And then I need only half as much coffee.
Exactly. If you want to do it quickly, then it awakens it. If you were going to work with a sports person, you would do it very quickly all over the body, and then you're really sort of in your body. But if you're working with a chronic pain patient, it needs to be modulated, slow and gentle, and reframing their chronic pain and asking them to breathe. And what we do then, we combine, for example, working with that, and then breathing to the Fascia-ReleaZer.
Okay, great. Yeah.
So you have two forms of rewriting technologies, which help the patient then to reframe their pain.
I would be also interested to see, it seems the skin is redder.
Exactly.
That you have an increased circulation there.
Absolutely.
That would be interesting to see. Would be also interesting to see if maybe nitric oxide is produced. I don't know. With the foam roller, they have showed it, but it has more pressure.
Well, all I can do is to thank you very, very much for your presentation at the British Fascia Symposium. I was delighted. I've seen many, many of your lectures, but I was particularly impressed by this one because it bridged the gap between science and what the practitioners are asking for.
And you are one of the few people who knows and treats the tissue as well as the central nervous system.
Thank you.
Many people, particularly in America, they either treat the brain or they treat the tissue. And it makes a lot of sense to combine.
Well, thank you very much.
Congratulations.
Thank you very much.